In our first segment today, we're talking with Dr. Maria Rossi, a family medicine doctor with ThedaCare Physicians-Menasha. Dr. Rossi, thank you so much for being with us.
Oh, no problem. Thank you for having me.
So we really want to dive into preventative care for our patients. And what we'd like to do today is we've created some puzzles using emojis, and we're wondering if you can guess what the preventative care measures are and then talk us through those.
Sounds like a plan.
Okay, let's start with our very first one. Up here, you can see the emojis. Any guesses as to what type of preventative care this might be?
Well, with a stethoscope, a calendar, and a check mark, probably a yearly wellness check.
That's it. Okay, why are wellness visits so important?
Well, they help us do a lot of things as primary care physicians. It gives us that one time a year to check in with the patient to make sure they're doing well overall. And it's going to be a thorough exam that goes over their entire medical history, reviews screening tests they need, blood work they need, update medication lists, as well as any concerns they may have.
All right, let's take a look at our next puzzle here. What do you think those emojis represent?
Well, I think with the drop of blood, the microscope, perhaps your blood work that you should be getting done. And I do think this is very important. It is a way for us to monitor whether or not we're doing, as physicians, an appropriate job of managing patients' medical conditions and making sure their medications are appropriately dosed.
Okay, that's good to know. Let's take a look at our next puzzle up here. More blood on this one. What does this represent?
Well, we have a heart, and again, more blood work, as you said, and then maybe some annual cholesterol, blood pressure, and heart screening.
I think that's it.
Yep, and those are all things we do look at at an annual visit as well. A lot of times patients may already be on medications to treat one of these processes, but if they have a strong family history, it's also important to check those out too.
Okay. All right, next one here. Oh, I like these emojis. This baby here. What does this one represent?
Well, you have a measuring stick with the baby, stethoscope, probably the well child visit and making sure their growth is appropriate. So I would say that is one of the first things we do in every well child visit is make sure patients are tracking appropriately along the growth curve. You never want to see a patient jump too high in terms of gaining or growing too quickly or too slowly over the course of a year. So it's always important to check over the course of a month, whatever their visit is due.
Okay, great. Our next one up here, any guesses on this one?
The emoji with the Z's would probably make me think about sleep.
Yeah.
So probably sleep and sleep apnea.
Yes.
All very important topics to discuss as well. Sleep is a cornerstone of our overall health. We talk a lot about it in terms of making sure we decrease our risk for heart disease and obesity and as well as just fatigue. So it's important to talk about it at wellness visits.
Absolutely. All right, our next puzzle. I think I know this one. Okay, what's your guess?
All right, there looks like there's a virus and then also a shot, which is vaccines and disease prevention. And again, another one of the cornerstones, as we say, for the wellness visit, but extremely important. Vaccines have been shown by many studies to prevent the spread of illness as well as the contraction of illness and prevent death as well.
And then whenever you go in for your annual wellness, will the care teams talk with you about which vaccines are due and what your schedule looks like and all of that?
Absolutely. So it changes tremendously from the age of the patient. So especially our patients under the age of 12 months, they have quite a few specific vaccines that are due at different wellness visits. And those will be discussed in detail by the provider, as well as once you hit a certain age. Especially our patients that are 50 years and older, they tend to have a lot more vaccines that are indicated.
Oh, okay. Good to know. All right. Our last one here. What does this puzzle represent?
The pill, I think, gives it away. So maybe medications that patients are on. That is something that is very important. Again, one of the first things we do whenever a patient comes for their wellness visit is we go through all their medications, make sure they're taking them appropriately, make sure the doses are accurate, and doing the job they're supposed to do. So it's a very important part of the visit as well.
Absolutely. And all these things, again, just really important to start with your annual wellness visit. And how important is it to have that relationship with your primary care team?
Oh, extremely important. The part of the primary care team is to really coordinate the care from all the specialists that they are seeing other specialists. The other opportunity is just to have, again, the relationship is huge because it allows the patient to open up and really bring to the forefront the things that are really bothering them or concerning to them that they may not feel comfortable mentioning to other people. So that's really where our role is to be the first contact of healthcare for the patient.
And again, really important.
Yep.
All right. Dr. Rossi, thanks so much for being with us and for playing our game.
Yeah, no problem. Thank you for having me. It was fun.